Hi everyone, welcome back to our channel Nursing Verse K. In this video, we will discuss about the gastritis. So stay tuned till the end and don't forget to like, share and subscribe to Nursing Verse K for more exam focused content. Let's start. Gastritis. What is mean by the gastritis? Gastritis is an inflammation of the gastric mucosa that may be acute or the chronic. That may be acute or chronic. It is an inflammation of the gastric mucosa that may be acute or the chronic. It is known as the gastritis. In the gastritis, there are the two types of the gastritis. One is acute gastritis, and another is chronic. Acute and chronic. What is the acute gastritis? Sudden inflammation of the stomach lining. Sudden inflammation of the stomach lining, known as the acute gastritis. It is maybe usually reversible if the cause is removed. Next, chronic gastritis. What is meant by the chronic gastritis? What is meant by chronic gastritis? Long-standing inflammation leading to atrophy of the gastric mucosa associated with the H. pylori infection. Autoimmune disease, alcohol, smoking, and chronic non-steroid anti-inflammatory drug uses can lead to peptic ulcer disease or the gastric carcinoma also. Next, what are the causes of the gastritis? Like infection like H. pylori, viral, fungal infection. Drugs, like some of the drugs uses like NSAIDs, non-steroid anti-inflammatory drugs uses aspirin, ibuprofen use, and corticosteroids. Lifestyle factors, like alcohol, excessive alcohol, smoking, and excessive stress can occur the gastritis. And next, autoimmune gastritis. Body produce antibodies against partial cell and instinct factor like pernicious, it's occur pernicious anemia. Dietary factor like spicy food, contaminated food, other causes like radiation, corn disease, sepsis, etc. Clinical features. What are the clinical features? Clinical features. Acute gastritis like epigastric pain, nausea, vomiting, loss of appetite, hematemesis, vomiting in the blood, hematemesis. Known as blood in the vomiting in the blood, known as hematemesis. Bloating, indigestion, and chronic gastritic clinical features is for chronic early satiety, nausea, anorexia, vitamin B12 deficiency, vitamin B12 deficiency, weight loss, early satiety, nausea, anorexia, vitamin B12 deficiency, weight loss. These are the clinical features of the chronic gastritis. What are the complications? What are the complications? Peptic ulcer, gastritic bleeding, gastric outlet obstruction, pernicious anemia, gastric carcinoma, etc. What are the diagnostic evaluation? The diagnostic evaluation should be history and physical examination, endoscopic diagnostic evaluation. We can write the diagnostic evaluation. Endoscopy with biopsy, test for the H. pylori test, urea breath test, stool antigen test, and rapid urea test. And what are the laboratory tests? Laboratory test should be CBC, check for the anemia occurs or not, check for anemia. like vitamin B12 level in chronic cases, then occult blood test in stool. What are the management of the gastritis? Management should be general measures NPO, nothing per oral. If is in the serious condition, avoid alcohol, smoking and spicy food, and then eat small and frequent meal. Stress reduction. Pharmacological treatment for H. pylori eradication. We used the H. pylori eradication. We used the triple therapy like PPI, omeprazole or pantoprazole plus clarithromycin and amoxicillin plus amoxicillin. We used duration, we have to use in 14 days. For acid suppression, we used the PPI. is, we already told the full form. H2 blockers like ranitidine, famotidine, and famotidine. And for the antacids for symptoms release. Antacid used for symptoms relief. Vitamin B12 injection. In autoimmune gastritis with the pernicious anemia, we use the vitamin B12 injection. Then we will see about the nursing management. Monitor the vital signs, fluid electrolyte balance, and assess for signs of GI bleeding. We will assess for the sign of GI bleeding like melena, hematemesis. Provide small and frequent non-irritating meals. Educate patient about avoid alcohol and smoking. Assess for the sign of GI bleeding. Provide the small frequent food and non-irritating meals, and avoid alcohol and the smoking. Monitor for the anemia and vitamin B12 deficiency. What are the key points? Like we will see the key points of the exam point of view. Key points like H. pylori, most common cause. common cause. Next, autoimmune gastritis occurs in autoimmune gastritis occur in pernicious anemia. Pernicious anemia. Triple therapy used for treat the H. pylori eradication. Thank you everyone. If you are liking the video, and please like, share and subscribe our channel for more content.